More than 1 million people have died in the COVID-19 pandemic. The World Health Organization has called it a very sad milestone. It notes many victims have suffered a terribly difficult and lonely death, with their families unable to say goodbye. The US, Brazil and India account for nearly half the total fatalities worldwide. It took just 3 months for deaths to double from 500,000 to 1 million. And the death rate has increased in recent weeks as infections surge in several countries. Currently, about one person every 16 seconds dies from the virus. More than 33 million people are now infected. But health experts say those figures significantly underrepresent the real tally.
And in fact, if anything, the numbers that are currently reported probably represent an underestimate of those individuals who have either contracted COVID-19 or who have died as a cause of it.
So look, we're joined by Dale Fisher. He's professor at the Yong School of Medicine and chair of the WHO's Global Outbreak Alert and Response Network. Good evening, Professor. Dale, this milestone, a terrible one, comes amid this surge of cases that we're seeing around the world. Right at the beginning of this pandemic, we were saying, how bad can this get? But we're still at a situation when it is getting worse. So how much worse is it going to get?
Yeah, thanks, Dawn. Hi, Steve. It's obviously very country-specific how the future is going to pan out over the next month and year or 2 or 3. So some countries are doing better than others, obviously. I have to say Asia is by and large doing really well and has really, in a way, figured out how to live with the virus. Obviously, the aim is to have low transmissions, low death rates, while allowing a fairly normal life to continue as much as you can, this new normal. But really, so much of the world has got excess mortality, worsening socio-economic gaps between individuals. There's mental health issues, there's families divided, there's economic consequences in business and unemployment. So I have to say I'm quite pessimistic about how it's going to go in many countries. I'd like to be optimistic that governments and scientists and business leaders and communities around the world can all work together and create this new normal, which is still safe, but people can get on with their lives. But I think the Northern Hemisphere is going into colder months with higher numbers than ever. People are tired. Countries are out of money and can't keep propping up businesses and individuals anymore. So there's some misery to come, I'm afraid.
Yeah, it does seem rather bleak. Speaking about the doubling rate, which is also a concern, Dale, it did take just 3 months to get from 500,000 deaths to 1 million. What can we learn from this? What does this tell us?
It doesn't tell us anything we didn't know. You can watch the numbers evolve each day. It's not a surprise. Each day is very similar to the one before, unfortunately. But what it does tell us, if anything, is this is why you have to contain it. You can't think it's okay to let it run and people won't die. If you've got lots of transmission, you've got lots of cases, and therefore you're going to have lots of deaths. So you have to stop transmission, and you have to do it without crushing sort of societal and economic needs of countries. So we know how to control it, and that's what's happening by and large in most Asian countries. I think everyone's familiar with Singapore, but what has recently happened in South Korea, Hong Kong, Japan, they've brought high numbers down without lockdowns. And this is extraordinary, and it's a great demonstration to show you can work the non-pharmaceutical interventions to bring control still.
Dale, it has been 9 months since we've been living with the reality of COVID-19 and with this pandemic. And you mentioned the importance of stopping transmission. Is that what is most important in keeping patients alive? What else have doctors learnt about how to keep people alive through this?
It's the old adage, isn't it? Prevention is better than the treatment, if you like. So keeping transmissions low is no doubt the biggest, way to keep people alive. If hospitals become overwhelmed because there's large numbers of cases, then we know the death rate is even higher, because staff are either sick or in quarantine, they've got no ventilators, they run out of beds. So we've seen this happen in New York and Italy and Wuhan, when transmission runs freely, that we do lose control and we get even more deaths than we otherwise would have. There are some things that technically that we're doing better. I think ventilation techniques and ECMO and prone ventilation and things like this are useful. Obviously, dexamethasone was a good breakthrough that saves the lives of people with severe disease, or it decreases the mortality of people with severe disease. So there is some, technical advances, but still what we learned in February remains the adage, and that is that you just have to prevent spread.
And what do you make of the talk of vaccines and how they're sort of progressing? We do know that many countries are being involved in this, and even Russia is saying that they were going to go ahead with mass inoculations despite concerns about its own vaccine and efficacy, and if the trials have been proven to be successful yet. What's your take on how we've been getting on with that?
Well, we're on track. The thing that's been remarkable is the effort to create vaccine candidates, but most of the rest of the process, particularly the phase 3 trials, shouldn't be rushed. And more importantly, we shouldn't be leaping at the first one that is said to be safe and effective. WHO has set a fairly low benchmark of 50% effectiveness. So that means when it's tested against a placebo, that only half the number of people get disease. So, but if you did that and then a few months later you found there was another one that was 80%, then the country might be regretting that. So the COVAX facility that's being undertaken at a WHO level has, I think, got about 160 countries now signed up, and they're going to take some more time with an ambition to start producing in the second half of next year, probably, and distributing by the end of next year. So they will look at several candidates, choose the best one for particular settings, whether it needs 1 or 2 doses, whether it needs a cold chain, whether it needs a booster. All these types of things can be considered, as well as obviously safety and efficacy.